Health. I'm your host, Dr. Malea Jensen. We are live this morning on YouTube and Instagram. So YouTube and Instagram, please share this. Good morning, Lucy. You're my first one. I appreciate you guys starting the ball rolling here. This is my co-host. This is Tucker. Tucker is helping me from heaven. So if you guys don't know about Tucker, he's got quite the story with me. He is my baby boy that passed away in February. So I cherish him, and I hope that you will allow him to partake in as a co-host from heaven. So we will put him here. He glares because he's got a mirror, but he's right here. And so we're going to get started here. Good morning, Nancy and Mimi. I appreciate you guys being here. So we will get started. If you guys have questions, please don't hesitate. Medical questions that I might be able to help you answer. Again, this is not medical advice. I'm a physician. You guys are patients of someone, but not my patients. So this is not medical advice. It's for information purposes only. Oh, thank you, Tobacco. It has been, I'm not sure that I've actually been the same since February, but it's a healing journey. When you lose something that means so much to you, I know that you guys understand. Touch of Wood is listening this morning from Dothan, Alabama, also known as, you're known as Patricia McLeod. I might not remember it. I kind of like the Touch of Wood. So Patricia, thank you for joining. Where are you guys listening from? What city, what state, what country? I appreciate you guys joining. It's 9 a.m. I am here in Iowa. I'm in Des Moines, Iowa. And I am a family practice physician. I have been practicing for a little over 27 years in June. So, I've had a lot of experience. I am not an expert in anything, nor do I claim to be an expert, but I'm very well read and I continue to read. I might not have all the answers. I likely won't have all the answers, but I want to help you even maybe trigger yourself to think about other things and maybe look stuff up. Okay? Questions are starting to come in. You guys, I am live on YouTube and Instagram. Please share this if you can. If you think that the information I am giving you is valuable, it's valuable for you. I would appreciate if you can share it with somebody who you might also think it's valuable for. So first off, here's a question. It's a question in regards to vitamin C. Vitamin C. Do carnivores need to take extra vitamin C? I've been told that carnivore is low in vitamin C. What are your thoughts? That's a great question. I would tell you that a carnivore gets enough vitamin C. In a nutshell, they get enough vitamin C. From a simple 12-ounce steak, like a ribeye steak, you're going to get 12 milligrams of vitamin C. We probably need about 15 milligrams of vitamin C per day. Now, why is it that some people consume much, much more than that? Well, the answer lies in the fact that when vitamin C is taken in by the cell, it goes in through a receptor called GLUT4. That receptor is on our cells. That receptor also is responsible for taking in sugar. So if you are taking in sugar, that is going to block that GLUT4 receptor, and then vitamin C can't attach or can't get in. So you need to either lower the sugar or raise the vitamin C in order to displace the sugar from the GLUT4 receptor site, the transporter site. So a person who's carnivore doesn't eat much sugar, so they will not have much chance to have that GLUT4 receptor blocked. The answer is carnivores don't need as much vitamin C as somebody eating a standard global diet. Plain and simple. Michelle is listening. She's actually getting ready for bed. She is listening from Sydney, Australia. I think they are probably 13 or 14, up to 17 hours ahead of us. So I appreciate you listening. Get a good night's sleep. Wake up, eat something very, very healthy. Exercise. All right. Okay, while we're on the topic, good morning, Ben. While we're on the topic, and Susan, good morning. While we're on the topic of vitamins, here's one about vitamin A. And just what about vitamin A? Okay. I guess it depends on who we're talking about. But again, if you're wanting to talk a difference between a carnivore or a vegan or somebody who does not consume animal products, you're not going to get vitamin A. Vitamin A, please hear me out. People who are plant-based will get beta carotene. Beta carotene will convert to vitamin A. There's a caveat to that, and I just want you to be very, very clear. Good morning, Midwest Ribeye. If you see Midwest Ribeye, if you're staying there and you're going to stay on YouTube, if you see a question come through, I've kind of got you pulled up so I can see you. If you see a question, can you relay that question? I'm probably not going to be reading much over there on YouTube because of the distractions, but I think it's important that we have availability to YouTube, but there is going to be a lot of distractions over there, and I apologize for you YouTubers who like to use that platform. It will get better. It'll get better in time. So getting back to the vitamin A question. Vitamin A is absolutely not found in plants. It does not exist. Beta carotene does, however. Beta carotene can convert to vitamin A, but beta carotene is not vitamin A. Now, in order to convert beta carotene to vitamin A, it requires T4, a thyroid hormone. If you are a person who has already, thank you, Midwest Ribeye, I appreciate that. If you are a person who has decreased thyroid function already, I don't think that you would necessarily want to be spending your T4 to be used on transitioning beta carotene to vitamin A. In the same sense, if you are low thyroid function, you don't have enough T4, likely, or it's T3. The whole process of, our brain, TSH, telling our thyroid to release T4, we want the T4 to be used to convert to T3. T4 is inactive. T4 is used for a lot of processes in our body, and one is to convert beta carotene to vitamin A. But if we're using it for for that function, then our thyroid function is going to suffer. I'm hoping you guys are on the same wavelength. So if I got low thyroid, I want to be using my T4 to convert to T3, not using it to convert beta carotene to vitamin A. I would simply rather just eat a steak. Okay? Vitamin A is found in animal foods. All right? So good question. I appreciate these questions. I know that in your head you've been taught that vitamins and minerals are going to be lacking in a carnivore diet or a ketovore diet or a keto diet, and they are not. Okay. Lucy says, subtitles in which language? I'm sorry. Lucy, help me out. I don't know what you're asking. Okay. Good morning, Carol. So we are a sick bunch of people. I think you can all agree to that. Okay. Okay. You guys are talking to each other. Okay. So I'll let Lucy, you take care of the triple P's or 4 P's or whatever it is. Peter. So anyway, we are a sick bunch of people. Disease is not natural, you guys. You know that by now. Having disease is not natural. You have been told over time that because you're aging, it's normal to have disease. And I'm here to tell you it is not normal to age and have diseases. Disease tells me that you have a substance, a toxin, whatever it is, in your body that should not be there. That's what's causing disease. Disease is very toxic. Something in you is toxic. And it is what doctors do, just say the average doctor. The average doctor is to actually treat the disease rather than remove the toxin. And I used to be that doctor because I'm not sure that I knew that there was other ways. I mean, I knew how I was going to treat myself, and that still is the same today. If somebody were to oppose me and say, Dr. Jensen, I think that fiber is needed and plants and vegetables are needed and some fruits, and we should just have a well-balanced diet and we should just try to just be happy. That is fine for you. You are more than welcome to do that. We have free choice. But I think one of the things that you are here for and you're listening is saying, is there a possibility that there's something else? Is it a possibility that I don't have to see my doctor? That I don't necessarily need to get diseases as I age? You see, I prided myself in diagnosing your disease. I put all the puzzles together. I tried to, think of what was going on, and I would do the symptoms and connect the dots, and I would give you a diagnosis. And I would tell you about the diagnosis. And then they said, well, what do you do? Well, doctor is going to give you a medicine. I was talking to one of my doctor friends today in the gym, and we got on a topic of constipation. And he's a general surgeon. His job is to chop block people and make them, basically a carpenter and make them all well again. His job is not to spend an hour talking to people about why they're constipated, what their diet is, and that sort of thing. With that being said, just because he's a surgeon, he's not taking the time, nor are any other doctors. We are paid by how many people we see. We don't get paid by the complexity of your diagnoses. I mean, you could come in with 10 problems. We'll get paid for about one. And so our goal as a doctor, I'm being honest with you, is to get you in and out as fast as possible. And that looks like seeing about 40 patients a day. And so I did that for a while. I probably did that so if I've been in practice for 27 years, I spent 14 of those years, I spent like a conveyor belt, seeing the patients, making a diagnosis, treating them. And then once they start coming in, basically you're on maintenance protocol. You have them come in every 4 months. You basically just do their labs again. You tell them, you're good, you're bad, stay on the medicine, do this thing, I'll see you in 4 months. I saw the patients 3 times a year. It was the exact same recipe. I would talk to them and say, you know what? Your blood sugars are going up, your A1C is going up. Are you doing your diet? No, I'm not really doing the diet. Well, do you want to do a diet? No, you know what? Maybe. Okay, tell me what to do. Well, I've told you this over and over again, but you don't seem to want to do that. All we're doing is managing your numbers. Okay, well, doc, well, I'm good with it. I'll see you in 4 months. That was most of the time. Unless they got a scare, like a cancer or a heart attack or something like that, they basically were comfortable with their own diseases. Okay? And Reinford, thank you. Appreciate your time and being here for us. Hopefully I'm pronouncing that right. What is going on in the medical world is how we've been taught. And I know it's something like you want to get mad at the doctor. Like, why don't they make a change? Why don't they do this? Why don't they do that? Because they've been bred, so to speak, to do it a certain way. We went to medical school. All medical schools are the exact same. Whether it's a private school or a university, the curriculum to become a doctor is exactly the same. If it was different, then you would have some people becoming doctors when they probably really shouldn't. And that still happens. I'm not telling you it doesn't, but they want to base everybody on the same thing. That's when you take board, like your boards, everybody takes the exact same boards. Now there's DO boards and there's MD boards, but they're basically written or underwritten by the exact same groups. So they want all of their medical people to be trained narrow-mindedly, okay? Now you can branch off and do your specialty, and for the most part, you're not going to get downgraded. If you're going off and you got your own ideas, is what I'm trying to get at. So say I have my own ideas about cholesterol, for instance. Okay, I've not that I didn't have my own ideas, but I kind of did. But now I don't follow mainstream idea about what cholesterol is about. There are guidelines still today that tell you need to be under a certain number. Miraculously, that number has changed over my 27 years. When I first started, that normal cholesterol number was somewhere around, I want to say it was around 240, 250, somewhere in there, okay? And we really didn't know much about LDL at the time, or even HDL. I think it was in the back of my head that we were learning about these things, but 27 years ago, it really wasn't a thing. Before I went to medical school, I did a topic for, I don't know if it was microbiology or it was some advanced biology or chemistry class that I took when I was in undergrad. And we had to do what we would call like a thesis paper. It wasn't a thesis like a thesis, but it was a paper. And then you had to present and it took a month. It was a May term class. I took it, it was the whole month, and the class was very small. And so when you gave a presentation, and then we talked about it and did all that. But mine was actually on cholesterol. I went and talked to, get this, where I got all of my information was from a pharmaceutical rep. So a pharmaceutical rep who had some information on the Framingham study. And at that time, the statin of choice, the medication of choice was Mevacor. And it had great data. So the rep told me. And so I did this study, but when I presented this paper, it was all one-sided. I never learned anything else. That basically just transitioned right into medical school and residency and everything else until I got to maybe 5 or 6 years ago. I thought something is wrong with this situation. We're still getting diseases. We're following the guidelines. In fact, yes, Litter, I agree. Dave, I agree. Lifter Dave. Jeez, I'm sorry. Yes, in fact, you could argue that really all studies are flawed. They are cherry picked, whether you want to believe it or not. There isn't an agenda whenever you read a study. Who's writing it? Why was it written? What is the goals? What is the outcome? Because the outcome is going to represent somewhere like, okay, LP little a is now the thing, and there just so happens to be a new medication on the market that's going to treat LP little a. But we really need to know the basics before we can give a treatment, okay? Because every disease, like I said, arises from something that's going into your body that's not meant to be there. It's a toxin. I like to give the example of a fat cell. A fat cell accumulates toxins, by the way. That's what it is. And fat, for the most part, is pathologic. White fat or subcutaneous or even deep subcutaneous fat is pathologic. Visceral fat is even more pathologic. Cancer is pathologic accumulation of toxins, whether you believe that or not. I happen to believe it. Now, not everything that we believe is truth. And so I've been on the path where, it's just genetics and you're a setup and, you're you're just going to get cancer. And so then you feed that to the person. And do you think that that negative energy is not going to bring on aspects of getting cancer or getting disease? You know, I can, for, you know, I can bring a personal experience to this. Is I still am an athlete. My dad was an athlete, and my dad had high cholesterol. He was told that his cholesterol was elevated. He probably did not start going to the doctor until he was 40. And that was probably about the time when they told him that your cholesterol is high and you need to go on a medication. My dad, for the most part, ate, I would think that we would consider it a standard American diet, but we did eat red meat. We ate a lot of red meat. We ate fish. We ate chicken. We ate a variety of meats. But we also had macaroni and rice and other vegetables. We ate everything. Now, we weren't a candy or a cookie or a potato chip, but we ate bread, we ate sandwiches. And so when they told my dad that he had high cholesterol and started him on this medication, I didn't really think a whole lot about it. I just thought, well, I guess it's necessary, you know. Then fast forward, my dad ended up having an episode of VTAC after running. And they took him to the hospital. He actually got transferred to Des Moines, where I was located and doing my residency. They found out that in figuring out why he had VTAC, they did an angiogram, and he had 5 vessels that were completely blocked. Did that cause the VTAC? Likely not, but they have a strong association. Any arrhythmia has a strong association with the plumbing system. So if the plumbing system is not functioning well, likely the arrhythmias, the electrical parts is possibly going to go wrong. Now, my dad did not have any death of his heart muscle. He had collateral blood flow, likely because he exercised. So he ran. So you had branches sprouting out that fed the parts of the heart where the blockage is. So if he had a blockage in the LAD, the left anterior descending, the right coronary, the circumflex, the left main, if those are blocked, then there should be no blood flow going to heart, and the heart, wherever that blood flow goes, should be dying. His was not. There was no death of any cell, so there was no ischemia, but he had this arrhythmia. And so, long story short, they put a defibrillator in him and a pacemaker and called it good. My dad continued to eat and follow guidelines, low fat, high fiber, rice and beans. Basically, my dad ate plants and chicken, boiled chicken. He would eat fish, lean cuts of fish, lean sources of fish. He gave up all red meat. I remember we went to some sort of a picnic with another family, and it was a large gathering. I can't remember what it was for, but I remember they were serving hamburgers. And I remember my dad saying, he goes, "Oh my gosh, this tastes amazing. I didn't even remember what it tasted like." So here was my dad following all of these guidelines. You know, maintain a low cholesterol diet, don't get overweight, exercise daily, all of these things, get sleep. He followed every guideline that his doctor told him. Yet, my dad still ended up with disease, coronary artery disease. And we didn't find the coronary artery disease. It was 20 some years later. Okay. So he followed the guidelines. He was taking the medication that they told him to take, yet he still developed it. And then some of you would say, you know what? Luck of the draw. Poor guy. He, followed the guidelines. It was just hereditary. I cannot get on board with that. I really can't. I think had my dad, stayed away from the doctor, it would have done his body good. He would have continued doing what he was doing, running and playing. He actually stopped running. He lifted weights. He still was an athlete. He still did the thing. But I guess my point being is we are told to do all of these things. Lower your saturated fat, exercise, do your cardio. Don't worry, they don't even tell you to lift weights. Resistance training, if there was one exercise that I could possibly tell you to do, it would be to lift weights or do resistance training. That might look like bands or barbells or body weight exercises for you. I don't know what it looks like for you, but you should lift weights to failure. If you're somebody, they told, women shouldn't lift weights. They shouldn't be doing all these heavy things. So women will pick up these 5-pound dumbbells, do 10 reps and call it like good. It is not good. Lifting a weight for a certain amount of weight or reps, you need to do it to failure. You need to tax your body. Stress your system. And we can talk about exercises. You guys are, if you have questions about exercises, I'm well versed in exercises as well. So I love doing exercise routines. I used to do that. Well, I was in medical school. I was training people. So I was training people in the gym and doing their meal plans and doing their workout routines. They didn't exercise with me every day. That would have gotten expensive. So I would write out a routine so they could do it when I wasn't with them. And so it worked out awesome. And it helped me with extra money to help pay for things while I was in medical school, spending the $200,000 that it took me to get done. I've been on a keto for 2 years, now found out my gallbladder has sludge with symptoms. Now they want to take it out. Doctor says due to high cholesterol. Have you seen this? No, I'm likely, Dave, now again, you're not my patient, but I'm guessing that you had gallbladder disease prior to going on a keto diet. And what happens when you didn't develop the sludge, you couldn't have developed the sludge if there is enough fat. Because what happens when we consume fat is the gallbladder will contract and release bile. If there's not much fat in our diet, then the gallbladder does not work. It doesn't need to work because there's no job for it to do. So the gallbladder's job is to secrete bile. So it contracts and secretes bile when it senses that there is fat that's coming into the system. So if you eat butter on your ribeye steak, then you're going to see the gallbladder will contract and shoot out bile enough to emulsify the fat that you just consumed. If you have not been consuming fat, your gallbladder gets weak. Go lay down. The boys are playing and I would rather not because then they'll start making noises. When we don't use the gallbladder, it gets flaccid, weak, flimsy. I call it a little weakling. And so if you were to then go out to eat and eat a high buttery ribeye steak and you've allowed your gallbladder to be flaccid, it's going to contract against that because that's its job. So if you have sludge or gallstones and then it sees that you eat a fatty meal, which you haven't done in a long time, then that's going to be a problem. It's going to be painful. If you are found, like Dave is found to have some sludge in his gallbladder, he could, if it's sludge and not gallstones, he could slowly add in more fat and get that gallbladder working again. And then eventually it can push out a little bit of sludge until it's cleaned out. Dave is obviously not my patient. I've not seen his testing, but it's something that needs to be gone very slowly. You don't want to just go slam a stick of butter and now you go lay down. So you just don't want to go slam a bunch of butter and a ribeye steak knowing that you have sludge in your gallbladder. Hopefully that makes sense. I'm not one for surgeries, but again, every case is different. I would do some things different. Lucy says, what was gallstones? What do you mean, what was gallstones? Gallstones is basically just hardened and calcified material. It's bile that hasn't been used. The liver will will produce bile, and then that bile is stored in the gallbladder ready for use whenever we eat fat. One thing I want to caution somebody like Dave, before just going and doing a, slowly adding in fat, and you've been told that you have this sludge, you want to make sure that your bile ducts are healthy. One of the things you don't want to find out is that you have some cancer wrapped around your common bile duct. That would be something that I guess I would want to know. All right. So, and the doctors are experienced in looking at imaging that would say, okay, yeah, we got a cancer growing in here. He's wrapped around the bile ducts. And that's the reason why you could not have gotten your bile secreted from your gallbladder. It ended up backing up. It got sludgy. And now we're just going to simply go in and take your gallbladder out. We need to find out all of the things, that's going on. Don't just say, oh yeah, well, I'm going to go to my general surgeon buddy and he's going to take my gallbladder out and everything's going to be fine. Because once they get in there and they find something, well, it's going to be a surprise. So find out, why is it that you get, prior to 2 years, what were you eating, Dave? Why did you get sludge in your gallbladder? Lucy says, what if it was gallstones and not sludge? There's still a chance that you can break down gallstones. And I have had patients personally, and again, I'm not telling people what to do, but from personal experience, I have had people that were noted to have gallstones, went on Amazon and bought gallstone breakers or kidney stone breakers supplements, and their gallstones broke up and they were slowly released over time and they were gallstone free. It is possible. And just because we have gallstones doesn't always mean that they're going to become are going to be a problem. The problem arises when the gallbladder is probably not as active as it should be. But if it's more active and more muscular, there's a chance that you're not going to get that ball valve effect. What I mean by that is, say your your gallstones are sitting in the bottom of the sac, the gallbladder contracts and it poofs the gallstones up. It's called a ball valve effect. And sometimes they can ball valve up into and block that entry where it goes out into the duct. And then when the gallbladder relaxes, then that gallstone might pop back down and be like sitting in the sack of rocks like it was before. So maybe just when it's constant, again, you want to go slow adding in fat, and you might want to do small, frequent consumption of fat, small meals, versus somebody like me who might eat one meal a day and eat 100, 200 grams of fat all in one setting. That would not be what I would recommend for just the casual observer switching from a standard American diet to a carnivore or a ketovore diet. Or I should say a keto diet. A keto diet is, ketosis, keto is a ketovore, carnivore, lion. It's just the number of carbs goes down. But also, in order to really be in a keto diet, you need fat. So many people say, oh, I'm in ketosis, I'm in keto. Well, really, until you start adding fat to your diet, that is where it really starts to happen. And we're starting to use and burn ketones as an energy source. Those are good questions. I appreciate that. Oliver asks, do high triglycerides cause coronary artery disease or not? Well, it's not that the triglycerides cause the coronary artery disease. It's metabolics. It's what caused the triglycerides. So you got to take a step back. Triglyceride to HDL ratio is what I like to look at in determining your metabolic health. If the triglyceride to HDL is over 1, then you are at risk of having a heart attack. You are metabolically unhealthy. When I say metabolic, I'm not talking about your fat burning possibilities. Metabolics is all the normal physiologic and biologic processes that are going on in your body. Metabolics is at the cell level with mitochondria and all the endoplasmic reticulum and all the other organelles. Metabolics is on your skin, exterior. So we have a lot of metabolics that's going on. But when a doctor really boils it down, we think of metabolic dysfunction to include 5 or 6 symptoms. And those 5 symptoms are high blood sugar, high blood pressure, high triglycerides, enlarged waist size, so like over 40 in a male, over 35 in a female, or low HDL. And when we have like 3 out of 5 of those, that is where we have concerns of metabolic dysfunction or metabolic syndrome or syndrome X or insulin resistance syndrome. So all of those things lead to increased inflammation in our body, increased risk of blood clots, and that is what leads to heart attacks. There are people who live with coronary artery disease and never have a heart attack. They have coronary artery disease, it's stable, and they don't have a heart attack. The inflammation is the problem. The blood clot is the problem. The high triglycerides, the high blood pressure, the high waist size, the low HDL is a constellation of symptoms telling you that you have unwellness, you have a disease. The disease is telling you that you have some substance in your body that is a toxin and your body's responding to it. The inflammation was caused by something. Was it high blood sugar? Was it high insulin? They work by different mechanisms. Was it smoking? Was it diesel fumes? Was it microplastics? Was it heavy metals? Was it iron overload? There's a lot of things. Was it burning wood? Was it burning plants? Was all of these, lack of sleep, all of these things that I just mentioned, and probably 100 more, lead to an inflammation. Our arteries get inflamed just like every part of our body does. When the inside lining of the arteries gets inflamed or damaged, it leads to dysfunction. And so the body tries to heal itself, but sometimes the body can't keep up. There's a glycocalyx that lines our arteries that can get damaged, like the slippery gel-like layer that's protecting you. The endothelial cells can get damaged. When they get damaged, our body can't keep up, especially if you're doing the thing over and over and over again, like high blood sugars, exposure to heavy metals, exposure to tap water, exposure to nanoplastics, exposure to tobacco, exposure to high insulin states. If we're constantly under pressure of those things, you can see where the inflammation causes an injury. And then the natural tendency is to go in and try to band-aid that injury, make a clot, like a scab. And over time, that clot will either be dissolved by the normal mechanisms in our body, or because of injury over and over and over, it calcifies. And the plaque is just, it's red blood cells and white blood cells and platelets and other debris, cholesterol. It's all these things wrapped up, forming like a hard, well, first it's a soft Band-Aid, and then it becomes calcified over time. So is it the triglycerides themselves that cause coronary artery disease or your heart attack? I'm guessing that's what you're saying. It is the whole entire process, Oliver. You have high triglycerides, maybe from beer, maybe from carbohydrates, which beer is, but you're putting poisons in your body that is elevating your triglycerides, and that is the warning sign. But doctors don't look at triglycerides as a warning sign. They're looking at your LDL. Your LDL could be in what they consider normal, and yet they're missing a heart attack. What if your LDL was 100, but your triglycerides were 200? Now, likely, your LDL is going to be higher than that. and I have not seen where many people have a 200 triglyceride and a 100 unless they're on medications. Now, if they're on a statin, they could still have elevated triglycerides. But the concept, the same thing applies. If your triglycerides are over 1 time your HDL, then you're at risk of a heart attack. Not because your LDL is elevated, not because your LDL is low. I mean, imagine taking all of these medications, lowering your LDL to 50 and still having a heart attack because no one ever told you that your triglycerides were way too high. Your HDL is not high enough. It had nothing to do with your LDL. Now, is LDL matter? Of course it does. The type of LDL matters. The type of LDL that is damaged by what we are consuming is called small, dense LDL. The large, buoyant LDLs, for the most part, are healthy. They're doing their job in your body. They're carrying cholesterol and delivering packages to cells. They are there for a reason. They are like a train. They're a car on a train. They're your automobile. They're delivering products all over your body. So when somebody tells you that you don't need them, they would tell you, well, you don't need a car in your body delivering packages. And you say, well, that's odd. I'm pretty sure that my body needs to have these packages delivered all over my body. But we've been so brainwashed that, and even myself, I'm not going to lie to you guys, one of the things I looked at, it was always LDL. I would look at it and go, oh my gosh, they got an LDL of 200. You better get on your, well, doctor, when do you think I should have started doing something? I said, when it was 160. Well, my other doctors told me it was 150, then 140, 130, 120, 100. Now it's 75 or 70 or 50. Well, when is it going to get low enough that it's going to, prevent a heart attack? And the answer is never. Once they figure out that you can't be bamboozled long enough, now they're going to tell you to look at something else. They're going to tell you to look at ApoB. I mean, ApoB is on every LDL particle. Small ones, large ones, it's on every one of them. So if they can now get your attention away from LDL and focus on ApoB, if your ApoB is over 130, you need a statin as well. So if you're measuring all of the LDLs, every LDL, in fact, triglycerides have ApoB too. So now you're measuring every LDL, even the so-called good bad guys. You're not just measuring bad guys. You're measuring the good bad guys, the necessary ones. You're getting an enlarged, raised ApoB. And they're going to get you to focus on ApoB. I've seen it. You guys are doing it. You come into my office and you say, Doc, can you get an ApoB? I heard that we need to check the ApoB. Of course I'll get your ApoB. We can talk about it. But I go, in my head, I'm thinking, how am I going to get this person to really start to think, why are they shifting the blame from LDL to something else? The other thing they're going to get you to focus on right now is LP little a. LP little a, they're going to tell you is genetic. And if you got it, if it's over 75, you are done deal. You need a statin or you're going to have a heart attack. You need a statin or you're going to have a heart attack. Well, doc, now you're starting to think, doctor, is that, I want you to think about what you just said. You're saying that you need to lower the LDL and lower the LP little a, and I won't have a heart attack. Did you just say that? Because I'm pretty sure that people are still having heart attacks with low LDL and low LP little a. How do you explain that, doctor? Well, that's just one case in a million. Those are rare. And then you could probably think in the back of your head, you got 5 people. You only have 10 friends and 5 of them had this scenario. The doctors can't get out of their own way. They don't want to learn. They don't have time. They're seeing 40 to 45 patients a day. Do you think that they actually have time? Then they got a family. Then they got to mow lawn. Then they want to work out. Then they want to watch TV. Do you think that they're going to expand their brain any more than they have to? You see, they're protected from malpractice or lawsuits because they're following guidelines. The guidelines protect them. So, Oliver, yes, high triglycerides increase your chances of having a heart attack. I am pretty sure that I have told you, Oliver, either privately via message or publicly via Instagram chatting, that your triglycerides are going to be the death of you. I told you why they're elevated. They're elevated because of carbohydrates. So you either lower the carbohydrates in your diet or you risk chances of having a heart attack. It's as simple as that. You need to raise your HDL and lower your triglycerides. They should be a 1-to-1 ratio, like 70 and 70, not 150 and 70, not 150 and 30. It's very important. There is a question, a good calcium question. What is it? Tell me what the question is, Midwest Rabbi. Oh, okay. I see. The question is, calcium covers the injury to protect the arteries from releasing a clot. But okay, so let's break that question down. So calcium covers the injury. It's not that the calcium is covering the injury. The injury attracted a bunch of things that made a calcification on that injury. Okay? That calcification probably started out like a soft bunch of stuff, right? And then over time, it calcifies. Now, a calcification, when we get a calcium score, we're measuring only the hard calcification. Likely the older stuff, right? It might be the old stuff. We're measuring that. You could still have a soft core inside that hard calcification. So you might hear a doctor say that at least your plaque is calcified, it's hardened. They'll consider that stable. In a way, that's right, okay? But a soft plaque can still break loose. And so my thought process is, we want to, one, not get a plaque. And how do you do that? Not get an injury. So you want to keep the injuries low. We're going to get a scratch. If you walk outside and you bump up against a tree, you're going to get a scratch. But you're not going to continue to bump yourself up against the tree to get more and more scratches, and your body can't keep up maintaining and healing them. Does that make sense? So if you got an injury in your artery, you need to stop what you're doing that's causing the injury. So there's the ability, your body has enough time and ability to fix that injury. You might initially get a little scab, and then he's going to dissolve. That scab, that clot will dissolve because we have normal biologic processes in our body that will help. If you have a calcification already and you're taking K2 and you want to decrease the calcification, that's fine. That calcification is not, it's just not the problem. It's telling you there is a problem, but it's not the problem. If we were that worried about the calcification, we would never ever be on statins, because statins raise our calcium score. Over time, being on a statin increases our calcification. The doctor may not tell you that. They may not know. They might say, you know what? Just the fact that you're aging is going to increase the calcification. We want you to take the statin because we want to I'm not even sure what they tell you anymore. What are the doctors telling you that, because there is no plaque regression with a statin. There's plaque increase with a statin. There is increase of calcification as we age. So if you say, I got a 0 score and a 0 score and a 0, there's still some calcification in your arteries. It's just not picked up. It's not enough that it's going to do any harm. I think you guys need to get in your head that the narrowing that occurs in an artery is not everything that's why you had a heart attack. Because most blockages, so to speak, do not occur until after the artery is over 70% narrowed. It had nothing to do with whether that was a soft plaque of calcification or calcified hard plaque. It's the narrowing. People with a 40, that's why they don't go in and do stuff until an artery is over 70% blocked. Like my dad's were 100% blocked. At that point, you couldn't string in a stent, not a stint, not an S-T-I-N-T, it's an S-T-E-N-T, stent. They couldn't do that in there, or they couldn't balloon it open because there's just not enough room. So they go in and bypass that area. It's called a coronary artery bypass graft. My dad had 5 of them. He was not having symptoms. They did it anyway. If you do a diagnostic test, you are going to get a diagnosis. Okay? And that diagnosis, once the doctor has a diagnosis, they are bound to give you a treatment. And in this case, they opened up my dad's chest and they bypassed all 5 of those vessels. No death of the heart. They bypassed it. Now, did my dad succumb? Did he pass away from having coronary artery bypass graft surgery? I'm not saying that. There are other things that contributed to my dad, one, even getting the calcification. What if, when my dad was placed on the statin, he didn't have any calcification? At that time, they didn't have a calcium score. There was no such thing. What if taking the statin and eating more sugar, more carbs? My dad avoided sugar at all costs. He ate sugar-free things, carbs, processed crap that were injuring his arteries. Bam, 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 every single day. My dad probably ate 4 meals a day. Over and over, injury after injury. His body couldn't keep up. His body couldn't keep up with the repair. Then they put him on a statin, or he was on a statin that increases your calcification. So no, Dave, I don't think that you are you're going to cause a concern by taking K2 to draw some of that calcium out of that plaquing. You're basically kind of helping your body. That is a normal biologic process. That K2 helps to control calcium in our body. Calcium that's drawn out of our arteries, put back into our bones and teeth. That is a norm. Whether you take vitamin K2 or not, your body naturally does that as long as it's not on a statin. If you are on a statin, you will never make enough vitamin K2 because you're blocking the natural pathway that leads to vitamin K2. You're also not going to have cholesterol. You know, people think in their head that whatever their doctor says, we need to lower your cholesterol to 100. We need to get your LDL down to 50. They're in essence telling you that you don't need cholesterol. In fact, I think they believe that if it was 0, you would never have a heart attack. But if it was 0, you're also never going to have kids. You're never going to have testosterone. You're never going to have estrogens. You're going to be andropause and menopause. You're never going to have an immune system. Your cell structure will die. You'll just fall like a heap on the ground. Your cell membranes, your cells are made of fat and cholesterol. And it's almost like the doctor, are you thinking? You know, doctor, are you thinking? You're lowering these, you're making the people miserable. You're building up calcification. You're causing them to not have intimacy. You're leading to low CoQ10 production. What about DNA production? What about your brain? How is it going to function? Yeah, but you're not going to have a heart attack. But I got diabetes, doctor. And I can't think. My memory sucks. My muscles hurt. I don't feel like doing anything. I can't share the gospel. Well, you know what? But you're not going to have a heart attack or a stroke. So what is the benefit? Is the benefit so you could get 4 to 5 more days of life by taking a statin for 5 days? Or excuse me, 5 years? So you take a statin for 5 years? Studies have shown, and again, you could fight me on this and say, Dr. Jensen, you said that studies don't mean a thing. They might not. But these studies have indicated that you'll get maybe 4 or 5 days extra life. But you're going to be miserable in those 5 years. And what if you're on them like me? I was on a statin for over 20, getting to my point that they fear you. I was a doctor. I knew that it was LDL and cholesterol. It causes coronary artery disease. You're going to have a heart attack. And then I thought, oh, my dad, he had 5 vessel disease. I got on the statin even more earlier than he did. I was exposed already in my shorter life to more statin than he was, and he had 5 vessel disease. Now, I did get a calcium scoring test twice now. Since my dad passed away, I've gotten a calcium score twice. It is 0. But I also do not subscribe to a low-fat diet, a sugar-free diet. I just simply don't eat the carbs. I don't smoke. I'm not going to go live in the city in the smog and have diesel fumes. I'm going to try not to drink nanoplastics and drink out of plastic water bottles. I'm going to try never to eat seed oils that damage the cells and cause oxidation. I'm going to try all these things. My dad was convinced because his doctor told him. He followed all the things they told him to do, and I don't subscribe to that. That could be why my calcium score is 0. And it could be why the statin didn't increase my calcium score. It never had a chance. It never had the nidus. It never had an injury. Or there's injury, like I bumped up against a tree and I scratched myself, and I was able to repair it. I'm not going to drink alcohol and smoke and go out for burritos. I'm not going to do it. You can. It doesn't bother me. You can choose to do whatever you want. But at some point, you have to say, hey, I guess I caused my disease. And I'm good with that. Oliver says, I have a 36.6 inch waist. I lift weights 4 times a week. My only thing wrong is low HDL and high trigs. No, that's not the only thing wrong, Oliver. Just because you lift weights, Oliver, a 36 inch waist, it's a little big, okay? But honestly, you're going to wait till you got 40 and now you got 2 symptoms. But Oliver, your trigs are high. Your HDL is low. Okay? You need to fix your diet. Are you on testosterone? Testosterone is a normal, it will lower your HDL. So there's more things going on, Oliver, than what you're wanting to, give information publicly. But I've suggested to you, if you want me to go over your labs, to discuss your medical history with you, to go over your medications, consult with me. Spend an hour with me going over everything during a video consultation. I'm going to be able to give you more information than I can with your little here and there tidbits. Oliver, I respect you. I appreciate you wanting to listen and get well, but I think you need some more in-depth training. And like I said, I would be happy to offer that to you. My cost of spending an hour with me is very reasonable. And I think many of you who are listening right now have spent $110 to spend an hour with me and get some information that they can use to make better decisions. And Oliver, you're one of those people that needs more information in order to make better decisions. Because the fact that you lift weights means nothing when you have injuries to your insides. The 20% impact that lifting weights is going to give you isn't enough to take care of the 80% of disease that's in you, okay? You cannot out-work out your diseases. You cannot outrun them. You're not going to be able to fix it until you fix it. Does that make sense? I'm not trying to be harsh with you. I'm trying to give you the bare bones information that, your CRP is under 1. That's great, Oliver. Is that the only thing that you want to measure? So you lift weights and your CRP is under 1. Those are excellent, excellent things. Keep going. Will muscle mass help my metabolic health? The answer, in a nutshell, is yes. But why do you want to continue to consume the metabolic problems and try to out-muscle them? That seems backwards to me. It seems insane. It's almost like I want to use heavy-duty water to put out a fire, but I'm going to continue to kindle the fire with some wood chips. Oliver, I don't get it. Okay? I will never get that. I know, Dr. Jensen, you're kind of all or nothing. That's the way I deal. If you don't want to be all or nothing, then don't. Don't. Play with fire. It's up to you. You, Oliver, honestly, you may never have a heart attack. You could die of cancer first. You could get hit by a train first. Well, that's pretty rare, Dr. Jensen. It is. It is. But you have to decide what you're willing to take a risk. I call it Russian roulette. What chances are you willing to take? I'm a fairly conservative person. I don't like to take chances, especially when it comes to my life. I think you guys deserve better. Why would you be listening to somebody who wants to take risks with their life? That's the person I want to help heal me? They're taking risky risks with their life. I can't subscribe to that. Oliver, I'm not going to go over your labs. I appreciate that you want to get better, but I'm going to leave it at, if you would like more information, please consult me. Email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Lady Daisy says, hello from Florida. Hello, Lady Daisy. Lucy says, I'm in the gym now pulling some sled. You know what? I looked at that sled yesterday and I was going to say, I'm going to do that today. And then there got to be a lot. There's only one little area where you can use the sled. So it got a little busy. So I'm going to do that tomorrow. Arambula says, that's exactly what they said when my calcium score was marked at what they called a medium score. God, I don't know what that is. What is a medium score? Honestly, you guys, a 0 score is like normal. You want a score of 0. If it's over 100, we got problems. If it's over 400, we really got problems. We need to look into some other things. So I don't know what medium is. And you guys, honestly, I would love to tell you to stop testing. I would love to tell you to just live your life. Stop putting anything fake in it. Anything that's processed. If a human made a particular thing that you're going to put in your mouth, don't consume it. It's only causing disease. It is a toxin. Man-made, human-made things is what's causing your disease. You might think but that's how things progress and evolve. And, we're going to have people who make this and make that. But that doesn't always mean that you have to consume those things. If fruits and vegetable, people say, well, they're not human made. They are. Fruits and vegetables in modern times are human made. Those seeds are not real. They are not found in nature. A grape in our store is not a grape in nature. A grape in nature is smaller. It's seeded. It's only seasonal. It does not grow all year long. It grows seasonally. It's wild. It's got seeds still. It's sugar. There's probably very little sugar in it. That is natural, not what man is making and putting on your shelves. But hear me out. If you go from a processed, boxed diet, cereal, bread and sandwiches and chips, and then macaroni and cheese or Big Macs for supper, or what, burritos or tacos or what, that is a standard American diet. And if you go to eating fruits and vegetables, I guarantee you success. You will successfully feel better, lose weight, probably look better. But over time, you're putting in just as toxic stuff as you were with the Macs and the Doritos and the macaroni and cheese and the sandwiches and the potato chips and the boxed cereal and the fake milk. It's all made by man. And I try to stay away from those things and consume animals. And how I prepare those has changed over years as well. I used to like my meat on the done side. And I have progressively gotten it to a place where it's more raw. Why? Because there's more nutrients in undercooked meat than there are in overcooked meat. If I want the biggest bang for my buck, I want it less prepared, less cooked. I haven't gotten to where I would eat raw. I haven't gotten to that place. I've honestly only been strictly what I would consider carnivore for about 3 years. Does that mean I have never in those 3 years eaten off the carnivore diet? Absolutely not. I mean, I do have birthdays. I do have family members that have birthdays. I have friends who have birthdays. But honestly, 3-4 times a year off of the carnivore diet, yep, that's a lot of less injury than most people. So with that being said, there is a reason why I stay away from plants. Plants have toxins in them. I cherish my ribeye steaks and I don't want to have plants next to it because plants decrease absorption of everything I'm trying to put into it. There is not enough nutrients in a plant that will, 1, make my steak any better, or 2, replace my steak. There is not a plant in the world that can replace my steak as far as nutrient density. I'm going to stick with the steak. Do I eat chicken or turkey or pork or fish? Occasionally. It is not something I do on a regular basis because the nutrient density is not there. I consume ruminant meats. I like deer and bison and elk and buffalo and cow and sheep and lamb. Those are the things I consume. You see, the chicken and the turkey and the pig, they're monogastric animals. They're monogastric animals, meaning they have a one-chambered stomach, just like a human. And so they aren't able to clean and filter and process things like a multi-chambered stomach can do, which is found in a ruminant animal. I'm going to choose ruminant animals. They eat the plants I'm not going to eat. They need it to make their protein. They eat plants to make short-chain fatty acids, to make proteins. I don't need to do that. I'm going to consume them to get my protein. Do I consume short-chain fatty acids? I do. Every animal product will have saturated and unsaturated and chain, small, short, medium, long chain fatty acids. When we consume plants, we're just blocking the absorption of things. I started out this whole conversation answering a question about vitamin A. Why would I consume something that doesn't have vitamin A, it doesn't exist, and have to rely on taking in beta carotene that can convert to vitamin A with the use of T4? Why would I want to use up my thyroid function to try to convert a fake plant nutrient, beta carotene, into vitamin A when I can simply eat the animal that is full of vitamin A? That's where my head is at. And so I've never been simply a plant-based person. Now, I ate crap, but it always included some meat. Always. I've never been completely plant-based. Minus times when I was really hurting for money when I was in medical school, I ate cereal and macaroni and cheese and ramen noodle soup days on end. That is a plant-based diet. No, I didn't eat vegetables. They suck. I didn't like the taste. There's a reason why. Because they're not good for us. And my brain and my tongue and everything else was telling me, that's junk. Don't eat it. But the fakes, the really, really fake stuff, the ones they jazzed up with flavors and natural this and natural that, that's what I ate. And it was heart healthy. It had fiber in it, right? We don't even break it down. That box of Cheerios that I thought was so good for me, because it had fiber and it was adding to my statin, I was a mess. It was no wonder that I had to, I couldn't focus. But I blamed it on not having enough money. Could I have gotten a bigger loan? Absolutely. But in my head, I said, how am I going to pay this back? How am I going to pay this back? So we have to live the way we live. But again, I was bamboozled. I was bamboozled in addition to that. Because had I known what I know now, no amount of money, I would have, to raise money, I would have done a lot of different things. Okay? I'm just telling you, I would have raised the money. I would have worked. I would have done something. I would have babysat. I would have walked dogs. I would have done something to make enough money had I really known that Cheerios were bad for me. Had I not been bamboozled by the heart stamp. It's really sad, you guys. We've all been there, even doctors. I am the most highly trained person in society. I spent years getting educated. I spent a lot of money getting educated. And you people, this is a very, very good compliment, are smart. Many of you listening are heads and tails in smarts above me. You've been looking at this for much, much longer than I have. And kudos to you. I had a paper sack over my head and I could not get out of my own paper sack. I regurgitated everything I was taught in medical school, residency, and on and on and on, all the continuing medical education, until one day I said, you know what? And if it wasn't for you guys, not you guys specifically, unless there's a few patients that are actually listening to me right now, if it wasn't for you guys sending me studies and telling me gently that you think I'm wrong, it would not have gotten my eyes open. I am so thankful for my patients. The ones that wanted to probably strangle me, punch me in the face, and rip my hair out. They wanted to help me so much because they respected me. They respected me so much. They gave me patience and gentleness to try to show me that there is something else going on. And I will never forget those people. I may never see them again in my entire life, but I will go to my grave remembering them and what they did for me. So if you're listening, thank you. And I have taken that ball and rolled with it. And now I listen to people that you think may not have any education whatsoever. They are you guys. And I'm listening. And I'm going, is that possible? And then I go look it up. I have listened to people that have absolutely no education whatsoever. And I have listened to some people who are brilliant. They've jumped out of the matrix long before I did. And they are fascinating to listen to. How they know our body, it's fascinating. It truly is. And I'm actually indebted that, you know, to you guys and to people who, you know, that spend the time and educate themselves. It's simply amazing. Statins do raise calcium. Yes, they do. But docs say it's to protect you from a stroke. Okay, so let's talk about that. If there are two things that a statin does for you in terms of protecting you, it's as an anti-inflammatory and as an anti-thrombotic. There are aspects to statins that help decrease inflammation and decrease the risk of blood clots. It's true. But my thing is, why would you take something with a whole bunch of side effects when you could just remove the thing that caused the inflammation and the blood clot in the first place? The biggest cause of blood clots is fatty liver. Well, doctor, where does that come from? Where did you get that one? Where did you pull that one out of the hat? Well, if you know that every fat everywhere in our body has hormones. It is an endocrine organ. Our fat is an endocrine organ. It secretes hormones. Visceral fat, so that fatty liver, that visceral fat releases a hormone called tissue plasminogen activator 1 inhibitor. It inhibits a enzyme, something in our body that helps to break down clots. It promotes clots. Visceral fat promotes clots. Insulin resistance leads to fatty liver. So Dave is saying that their doctor is telling them that statins are going to prevent against stroke. In a way, they're right. But they didn't tell you that you're going to be miserable all of your life. And why don't you just stop putting the toxin in your body that's causing the injury? Because the statins are actually causing injury too. They're just not going to tell you that, or they don't know that. So it's either malice or it's ignorance. I don't know which is worse. When you have heart failure, you need statins. Tell me why. Dave says ubiquinol does wonder for heart failure. That's because they didn't have any ubiquinol being formed because they were on a statin. Statins block the production of CoQ10. CoQ10 converts to ubiquinol. Midwest Ribeye says, question, any suggestions on fertility? People who are infertile likely have a low-fat diet. They are eating a standard American crapola diet. They are infertile. They have low fat intake of saturated fat. I'm not talking about plant fat. Plant fat will not make you fertile. But if you are infertile and you go on a carnivore diet that's very high in fat, you will become fertile. You will become fertile. And the male that does this will have better sperm, more sperm, and better sperm. But the male has also been under eating fat because he didn't want to get fat. Fat does not make you fat. Go lay down. I heard some talking, so I have to nip it in the bud. So Midwest ribeye, if you know somebody that, I'm guessing you're asking for a friend, and go carnivore and you will become fertile. You need fat. The body, Ingrid, said hi. The body makes hormones with cholesterol. Yes, it does. All of our sex hormones are made from cholesterol. If you don't have hormones because you don't eat fat, that is the problem. Okay? You are doing your body a disservice by not eating fat and cholesterol. You never have the building block that can make testosterone or estrogens. And I can go through that process very, very quickly. You do not have to know this, but fat and cholesterol make pregnenolone. Pregnenolone can make progesterone. Pregnenolone can tell the adrenal glands to make DHEA. DHEA converts to androstenedione. Androstenedione converts to testosterone, and testosterone converts to the estrogens, including estradiol. So if you have no first start place, fat and cholesterol, from an animal, you cannot get the natural productions of your sex hormones. There is more that cholesterol does. So Ingrid, thank you for that, that little piece of information. Polymath says, I took lots of risks. We all do. Pipkeeper, I'll get to your question. I took lots of risks. We all do. But I've been removing risks now that I'm 50. I've been weightlifting. Good. Eating healthy. I don't know what that is. And finally building a family. Awesome. Praise the Lord. God wants a big family. It feels like a lot of happiness. I would agree. It makes me happy just hearing this. I got a calcium score of 0 and an LDL of 180. Not enough information. But all that other stuff is positive. I don't eat any marketed packaged crap. Just drink water. I don't eat fruits. Good. Okay. Dave is helping me out with a medium calcium score is over 200. I could get on board with that. Polymath, darn autocorrect. I get it, Midwest. I've done that the same thing. So yeah, we're happy for Polymath. That's awesome. Okay, over to Pipkeeper. We are live on Instagram and Facebook. Please, you guys share this, hit the thumbs up, do the thing. If you are not subscribed, please follow, subscribe, hit the thumbs up, do your clickety-clack work. It helps me. Pipkeeper says, good morning, Doc. Being into the sea salt rabbit hole, found Dr. David Duarte from Mexico. The magic formula is 6 grams per 1 liter. Just did a 5-day water fast and then carnivore. So what is the magic formula? What are we trying to do? 6 grams is about a little over 1 teaspoon, you guys, of salt. And a good salt, like sea salt, like mineral salt. In 1 liter, so how many liters are you doing? So you're just drinking that 1 liter for 5 days of water fast and then carnivore? There's some docs, I don't want to say there's some knowledgeable people that would say 1 teaspoon per 8 ounces of water, a liter, 32. So I think you're on the right track, but I don't know what the magic formula is. Like, what are we trying to do? I don't know if Lara is listening right now, but she has tried to get me to read more and more about fasting. And it's not that, it's just like it had no interest to me, so I didn't take an interest in reading about it. But it just so happens that I started reading books that mentioned fasting in them, and now it's kind of piqued my interest. I have always, for the past 3 years, done some form of fasting. It was the long drawn out fast that I just wasn't sure I could get on board with. But now that I'm learning, I don't want to say I've flipped a coin, okay? I'm not there yet, but I'm learning the benefits of fasting. And I guess where it piqued my interest is when I started studying about cancer. And I see the benefits of natural healing of our cancer, which is a defense mechanism, just like your high blood pressure and your high cholesterol. Those are defense mechanisms in our body to protect us from toxins inside of us. And so the only way you can have maid service come to your hotel room, i.e. autophagy, you have to be fasting. You have to be in ketosis. There are doctors out there or knowledgeable people. I don't want to just say doctors. You do not have to be a doctor to be knowledgeable, but there's particular doctor, Chafee, says that even if you just ate meat, salt, and water, because you're in ketosis, you have autophagy. I agree. But if we have cancer, is the degree of autophagy that is produced from a ketotic diet, a ketosis diet, is it enough to take care of the cancer, to shrink and get rid of the toxins? According to what I've been reading, it's not enough. It's maybe great for prevention. So I don't want to get cancer. So I'm not going to put the toxins in, and I'm going to eat a carnivore diet. Then I'm in ketosis and I'm going through autophagy through the day. So maid service is coming to the hotel room and cleaning up my cells. Cell turnover can only occur during autophagy. Some of the parts can be reused. Okay, so if you guys like recycling, there's a lot of times that we can reuse some of the parts of cells and it's not all just lost. So autophagy is very important, not only just to prevent disease, but what if we already got it? And so that's where these fasts come in. In fact, if a person has, depending on the stage of their cancer, I would suggest to you that a 21 to 30 day fast will get rid of your cancer. It'll shrink it down. Can you do it? Absolutely. It could be painful. When that tumor is shrinking down, you might experience pain. When things are coming out of your body, you get pain. Some people can't stand it. They can't suck it up. I don't know what I could do, but I have experienced severe pain in my life. I have been told that I have a high pain tolerance. I've never experienced, as we get older, our ability to sustain pain, it gets less and less. I was one tough little character when I was younger. I could withstand a lot of pain. I don't know if I could get through the pain of a cancer. I don't know. I don't want to experience it. That's why I don't want to put toxins in my body. That's why I want to avoid them at all times. That's why I want to experience fasting at least daily, even if my fasting looks like 18 hours. Fasting. In fact, what about Pip Keeper not doing any water? What if he didn't do any water? Oh, Dr. Jensen, you can't say that. They need water, you're going to die. Our body can make water. We have water. We can make water. I don't think I would do a dry fast any more than 3 days, 72 hours. I'm not telling you what to do, but I don't think I would try to go without it that long. Sometimes you might need to sprinkle in a little salt. Pip Keeper is doing a 5-day water fast. He's adding some salt. There's nothing wrong with that. That salt is helping remineralize him. What else could possibly remineralize, get Pip Keeper more alkaline? It would be certain herbs. For instance, sarsaparilla or dandelion or burdock. Those, if I was to do, you guys know me by now. You know that I don't like to put any type of plants in my body. And herbs are a plant and they grow in the ground, whatever, okay? I get it. But you're not talking to the person, you're talking to the person, or I'm talking to that does not have cancer. So if I do have cancer, I might not do salt unless I really, really need it. If I was like, like falling over from dizziness or something like that, I might not do salt. I might do herb. I might do dandelion to try, because cancers cannot live in an environment full of oxygen and that's alkaline. They cannot survive. So what PipKeeper is doing is he's making his body more oxygenated. He's redeveloping his cells, and he's giving it minerals that are alkalinizing his body. Then when he goes off of his fast, he's ending his fast with carnivore. The longer the fast, you might want to start or end a fast, maybe even more simply, okay? Midwest, I don't know what a protein leak is, so help me out. If I did have this cancer, or I don't have cancer, I'm trying to prevent it, and I do what PipKeeper is suggesting, I might not want to end my fast, a 5-day, I don't know. I don't know if I would want to end my 5-day fast by eating a steak. The only time I would probably do this is after a fast. It would be an in-season seeded fruit, like grapes, wild, seeded, in-season wild grapes. Probably not going to find those. My carnivore startup would be something that could be digested a little easier. That's why I chose, even if it was 1 or 2 days, like 2 or 3 times a day of wild grape, seeded wild seasonal grape, that might get me into a state where I could tolerate some ground beef and some butter and that sort of thing, okay? So that was great. I thank you for PipKeeper, thank you. And if you have more to tell us, give us some information. Lady Daisy Grace says, the cardiologist who tried to pressure me into taking a statin said it would keep me from having a heart attack. He then said that he takes a statin and that he's half my age. He didn't convince me. Because you guys are getting smarter. You're starting to wake up to the fact that we have led a life of lies. I mean, we basically have. When it comes to the medical industrial complex, as opposed to some other complexes that we have going on in our life right now, but the medical industrial complex is so strong that we have been bamboozled. And see, what you guys have decided is that you're going to empty out all of those experiences and relearn things. And I think that's great. That's what I'm doing. But first, you have to admit to yourself that you were wrong. You have to humble yourself and say, hey, I was wrong. Oh, Kit, okay, for PipKeeper, instead of, this is just a suggestion, you don't need to do it. But what Kit does when she or he is ending a fast is they do bone broth or a couple of soft scrambled eggs. That's what they use. Or blend some chicken roast into broth so that it's more gravy consistency. So he or she, Kit, is saying that they're starting out a little softer, which I would recommend, and still keeping that carnivore diet. You never, ever want to end a fast with crapola food. That's fake food. They call it frankenfood. It's just fake. It's not real. So the fact that you should congratulate yourself and go out for ice cream and pizza is the wrong thing to do. So either do the broth or the eggs or both, or gravy, break up your meats or whatever it is. But never, chuck roast, never do a crapola diet to end your fast. It's defeating the purpose. Why be miserable? Oliver, again, if you want to, good luck benching 200 pounds on 0 carbs. Oliver, I've actually done it. So good luck to me. Thanks. I appreciate it. That's where I would draw the line, Kit. Adding a scoop of grass-fed collagen. That's fake. It's processed. Avoid it. I'm good with the butter. I'm good with the broth. But you guys don't need to be buying any fake processed crap that comes in a powder that you put in a container. And that goes for protein powders as well. Yeah, 200 pounds. I was pretty strong. I had a bench shirt on, Lifter Dave, just to be perfectly honest with you. I had a lift shirt on. It was actually 205. And I did it on 0 carbs. Anyway. So, anyway. Lady Daisy, the cardiologist tried to... Okay, I already read that one. Okay. I'm guessing, besides Oliver, other people have some questions. Jane says, hi, Dr. J. For a person at low risk of cardiovascular disease, can a calcium score test be more harmful than informative? Thank you. Oh, I go back and forth with this, Janet, sorry, Janet. I'm so sorry. Janet, I do go back and forth. And I feel that I'm probably not going to do another calcium score. If you were to listen to some cardiologists like Jack Wolfson, the natural heart doctor, he would suggest that getting a calcium scoring test is only putting more toxins in your body and not giving you any other information, unless, of course, you are not going to change your diet. If you are not going to help yourself, then get all the calcium scoring tests that you want to tell yourself that you're doing a bad job. Right now, I'm under the impression that we do diagnostic tests to make somebody else money. I'm just going to simply not do what's going to cause problems with calcification in my arteries. Don't do it. It is not hereditary. It's me feeding the genetics. I'm not going to feed it. So no matter what the calcium score says, the treatment is not a statin. I'm not deficient in statins. I'm overdosed in crapola. Do I need a calcium score to tell me I'm overdosed in crapola? I should be able to look in the mirror. That's why I wouldn't spend the money. I wouldn't spend the radiation. I wouldn't do these things. A diagnostic test gives a diagnosis. A diagnosis makes you a patient, and a patient makes you a treatment case. I don't want to distract you or dissuade you from getting labs. Some of you are numbers people. You like to have numbers as a baseline, and I'm all for it. In fact, that's my job. Help you read your labs. That is my job now. I am hired by you to review your labs because your doctor never did. And I need more than just a lipid panel to be able to tell you what is going on in your system, your body, okay? And if you need a list, let me know. I'll email it or I will message you. But what your doctor is getting these skimpy little labs and telling you that you need a statin. They're only looking at one thing, and that is an LDL. They don't even want to get a calcium score. That takes way too much of their time. Plus, they're going to have to interpret it. They don't want to. But the people who made the calcium score, they want you to do it because insurance doesn't pay for it. That's all just money in their pocket. One of the best things I could have done was just open up a little box, like a Morton building, and put some radiation walls in there and bought a CT scanner for calcium scores and then advertised it. I probably in 1 year would have been able to pay for that CT scanner because you guys are just so into it. When you get the number, what are you going to do different? If you're not going to change, don't get the number. If you want to get the number and it inspires you to make a change, get the number. But to continue getting the number and exposing yourself, I don't know. Okay? All right. So that has to be something. You shouldn't be influenced by what I said and what I do. Okay, one, it's for information purposes only. This is not medical advice. Not medical advice. I'm trying to give you some information to use to go to your doctor and say, hey, let's weigh the pros and the cons to this. Or don't go to the doctor and weigh the pros and cons. I don't know what that looks like for you. But if the doctor has been trained to only look at one thing and they can't get themselves out of their own paper sack, do you want their advice? Why are doctors like me going on the internet? It is surely not to make money. Well, for me, I can't answer for the other doctors because I'm not going to sell you something. There are some people, doctors, that have left their office and making a crap load of money by selling you something, some program, some whatever it is. That's not me. I don't want to sell you anything. I just want to give you information and hope that you'll make good choices. In the process, you will support me. I know you will. God is good. I've never been on the streets. I've never been destitute. For me, living is not living in prosperity and abundance, although I have my own prosperity and abundance. It just looks different than fancy houses and fancy cars and fancy clothes. It doesn't look like that, but I live in prosperity and abundance, okay? So you don't have to worry about me. But those of you who have supported me, I love you guys and I appreciate it. I'm still not going to sell you anything. I don't want to. I want to provide you information and then we talk about it. If I'm wrong, I'm going to be the first one to admit, I've been wrong in the past. I feel like I'm right now. I might be wrong. I'm going to keep learning and I'm going to get out of, I'm never putting the paper sack back on. I'm not going to do it. I'm never going to work for anybody. I'm never going to be told what to do. I'm never going to be told by the insurance companies to do a certain thing in order to make the money at the expense of the person. We get paid by putting you on statins, not directly, not from the pharmaceutical company. The insurance company they incentivize us for putting everybody on a blood pressure medicine, everybody on a statin. It's only killing people off. But they make money. If they can keep you from having a surgery, they make money. They keep you alive just long enough so you stop and die at 65. I mean, sorry to say it, but they really don't want you to live past 65. And then they have all these fresh things coming up. And the insurance companies make money from the pharmaceutical companies or the lobbyists or the whoever's that's supporting the insurance company because it's surely not you. You're wasting their money. You pay $1,000 a month, $12,000 a year. You get zero for that. You think that you're getting stuff for it? Yet you're getting a doctor who's prescribing the things that the insurance company is paying them to do. We get reimbursed by how good we are. Ooh, good little doctor. You're such a pawn. You're such a robot. You'll do whatever we say because you want the money. At some point, is the doctor going to wake up and do what's right? Get out of your paper sack? Open up your mind a little bit? When was the last time you used your brain? You're telling people that if you eat saturated fat, it's going to go down the mouth, down the esophagus, dump into the stomach, and then magically get into your blood vessels and plug them up? I mean, you would have to be a really dumb person to believe that. That would eliminate every process in the middle of how the fat actually gets broken down. You think that if I pour it down, it just magically goes into the bloodstream? That's a joke. Whatever happened to the bile? The emulsification of the fat? But now they've gotten better. They've opened themselves up a little bit and said, you know what? It's really not the saturated fat. It's not what you eat. Your body's making it. Your body's making it. Well, of course it is. But it's making too much. Oh, and now we got a statin. Oh, and you got a genetic LP(a). Here's that medicine too. And oh, your triglycerides are high. Forget the low carb diet. Let's give you some phenylfibrate. Oh, phenylfibrate and statins can't go together. I got another medicine. Wake up, you guys. I don't think that doctors are nefariously trying to hurt you. but they have an incentive to help themselves. Money is a huge incentive. Huge. They have families. Their kids are going to college. They want to drive. They got a status. They got to drive cars. They aren't going to drive a little Volt. No. They're going to drive Cadillacs because they have status and they want to show you. And they're the same ones that are wearing the stethoscopes around their neck, showing that they got status to you. No, they may have. They got status in education. They got status in their money, their bank accounts, maybe. I'm not trying to put down all doctors, but we need to be careful who we're trusting. Don't trust me. Go look stuff up. I'm not telling you to believe every single word I've said. Maybe it's wrong. There's either truth or there's not truth. And we'll find out when we're there. There's no in between. There's no like gray area. No, it's either truth or it's not truth. Some people would call that a lie. Well, it may not be a lie. It's just not truth. It's not truth. So our goal is to find truth. If eating fat does not go directly into your, like pouring it down a drain pipe, plug it up, then there's something else. Let's find the truth. But they're only going to give you a little bit because the agenda is still to make money off of you eating their fake food, crapola, and giving you medications and giving you tests. They make money off of tests. I never made money off of tests. I would send the labs out. I didn't want to make money off the tests. I don't know what I wanted to do when it came to making money off the labs. I personally did not want to buy the machines. I didn't want to buy the machines when somebody out there could do the labs for you. But what they did was they jacked up the prices. And then the insurance company has to jack up the prices. And then who's the price jacked up on? You guys. So now it's not $1,000 a month, it's $1,500 a month. Oh, and by the way, you have a $10,000 deductible. So you have to pay, if you get in an accident and you fracture your femur and you got to go to surgery, yeah, guess what? You pay the first $10,000. After you've paid over 12 grand in premiums. It's a racket, you guys. You already know this. I'm just speaking to the crowd and I'm sorry, but I'm just trying to say, there is one doctor who knows all about this. You know, my surgeon friend that I talked to this morning, I don't blame him. He's seeing the people after the fact. He just does his carpentry work. They need their gallbladder out. The doctor recommended that they have the gallbladder out. They go to get the gallbladder. He just says, chop, 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 take out, stitch, 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 gone. That's his job. He doesn't have to talk to anybody. He says hi and goodbye. Well done. I'll see you in a couple weeks, post-op, and blah, 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 blah. That's it. He's kind of got the best job ever. He doesn't really even have to talk to anybody. Where's the blame line? It's on the people. It's on the doctors that are seeing you guys on a regular basis. That's the me's. And the me's were telling you the wrong things or the untruth. Elaine says, I love how you are speaking up and speaking your mind. So much respect. We need more people like you. I try, Elaine, but I'm going to be honest with you. That's a scary prospect to speak my mind. And I have struggled with this, but here's why I'm not as fearful anymore. It goes down to this truth, not truth thing. To me, truth is Jesus. Okay? Truth is Jesus. Jesus is the truth. God is truth. And God will protect me. If I am giving you guys truth, He has my back. I can do all things through Christ who strengthens me. Okay? If something is wrong, I'm going to get a feeling. I have always had this gut feeling like something is wrong. I even remember years ago telling my dad, I had heard that statins increase our risk of getting diabetes. And I had 100 patients on statins, hundreds. Let's just give a round number of 200 people that were on statins because I believed LDL was the cause of heart disease. And I wanted to protect the person, just like what your doctor is telling you. I was one of them. But you know what? I remember telling my dad, I said, Dad, I kind of read this, and he was on a statin. I read that you have an increased risk of getting diabetes with taking a statin. And Dad, I've been seeing all these diabetics now. All of my patients are getting diabetes. And he just looked at me and I just kept talking. And I said to myself, maybe it's just they're eating crap. I mean, I knew they were eating crap. They're just getting diabetes from that. So I'm just going to keep them on the statins. But what if they weren't eating crap? What if they were getting diabetes from the statin because you can't control the glucose? You become glucose intolerant. I could have caused, there's a possibility I led people into a diabetic state and they fed it. Simply by following a guideline, by an insurance company, by the 3-letter agencies. I don't even know what's right anymore. You guys, I'm to the point where I don't even know what is right. I'm listening to you guys. You're listening to me. I'm trying to walk through these things, but what I can tell you, disease is not normal. And it is not normal to age and have a disease. It is not how God made us. He made us perfect in his image. But the world is feeding you lies and feeding you frankenfood and feeding you carbon, whatever. They're going to tell you that a cow is bad and it farts. Trust me, people who are eating crapola and plants have more farts than a cow. Guaranteed. They have multi-chambered stomachs. They know how to deal with it. They're making short-chain fatty acids from it. But we actually believe that. We believed 5 years ago that if you stood on a circle 6 feet away from somebody else on a circle, 6 feet away, you would not get what they got. As if it was going to jump onto you, but not if you're 6 feet. We believe that because they told us, they dangled death in front of us. You guys are afraid to die. Why? Why are you afraid to die? Are you afraid to die because you don't know where you're going when you die? Because I'll pray about that. I know where I'm going when I die. I'm going to be with Jesus. And no amount of dangling and messing with my brain with propaganda, dangling death. Take this, you won't die. Stand 6 feet away, you won't die. Get your LDL down to 100, you won't die. Eat a French fry. If you do this, I'll give you a French fry. That isn't going to make you die either. They're good for you. We need to use our brains again. And we are so accustomed to just having it all. I went to ChatGPT. Good for you. Go to ChatGPT. But you need to have something told. You can't even use your brain. Like, what is it about 6 feet? What was it magical about 6 feet? What was it magical that you could actually take your mask off if you're sitting down, but when you stand up, you had to put it back on? We are in America, and we did that. We called ourselves the land of the free. Because of people who died for us, we allowed them to dangle death before us. They're doing it every day. And they bamboozled the doctors to do it every day to you. I didn't mean to go down this direction, but I get to talking and I want to wake you guys up. I want to, even if I'm wrong, I want to get you to think. I want you to use your brain again. Even if I'm wrong, you're going to go look me up and say, I don't believe a word she says, and I'm going to prove her wrong. Hallelujah. Prove me wrong. That's what my patients did. That's why I'm where I am right now, is because of my patients proving me wrong. I hated it. I don't like to be told I'm wrong. But I do not mind telling you when I'm wrong and humbling myself. There was probably a time I didn't like to humble myself quite as well as I do now. But now I'm going to be honest with you. I don't know. But that can't be it. It can't be 6 foot. It can't be an LDL of 100. Because people are still having heart attacks when they're at 60, 50, 40 LDLs. And ApoBs are normal. we'll call it quits here today, but I mean, I could probably go down these rabbit holes, as Pip Keeper calls them, and do these things and you know, and talk to you. Lucy says, I had a consultation yesterday and I recommended anyone that wants to take control of their health and not have supplements or pharmaceuticals or a crutch or, you know, book with me. Yeah, I appreciate that, Lucy. And Oliver, it looks like he's going to make some changes. Sleds are your favorite. You can load them and still be very safe. Do it, Dr. J. Let me know what you think. Okay. I've done it before. I just haven't done it for a long time. Marnie says, give up produce for a few months, then try it again. Your stomach will not like it, and you'll see you are better off it without it. And Marnie, what you're telling the people is, you didn't even know it was harming yourself until you go off of it and then go back on it and see what you were actually experiencing. And you just thought that was normal. People think it's actually normal to pass gas and to have crampy abdominal pain and have large bowel movements. That is not normal. That is bamboozled propaganda fed into your brain like a dangling rabbit foot. Lucy says, I also eat meat cooked on the medium side. Not sure I can do less. Just little by little. It might even be one bite, Lucy. You might be amazed because sometimes I will sneak a bite from my mom when I'm making her steaks and she likes it on the rare side. So I'm getting used to it. Marnie says, please, ladies, eat your fat, quality meat. I did not, and it caused hormonal problems. Good advice. I love that advice. Lucy says, do you think if I did a 24-hour fast, it would help my ferritin levels? No, your ferritin levels are, I mean, yes, fasting will help, but your ferritin is abnormal because you have iron overload. You have locked up non-heme iron stuck in your cells. There's only a few ways that you can get that out, Lucy, and fasting is not going to do it, okay? It's great. It's helping you, but we've talked about glucoferrin, and I think that would be the best option for you. Keep your exercise up. Keep your protein high, your fats high, no carbs. Get on the glucoferrin and watch those ferritin levels change. Get that non-heme disease-causing iron stuck in your tissues out of your body. Romantics, I'm hoping I said that right. Oh, romantic at heart. Yeah. So romantic says the doctors keep pushing statins, saying bad LDL at 130, need to take statins. You said no. I'd like to give you a congratulations. Would you take a statin if you had a blockage of the LAD? Do I have collaterals? CK? Do I have anything else? Why did I do the angiogram that showed I have blockage in the LAD? What is the blockage in the LAD? Like how much? What was I doing that caused that blockage in the LAD? Okay. I mean, knowing what I know right now, and I'm only going to get 4 extra days. If I took the statin for 5 years and I'm only going to get 4 extra days, and I could cause diabetes, dementia, memory decline, diabetes, all neurodegenerative changes. No, I'm not going to take the statin. Dave says our vegetables in the States have GMO, and they're also fake. They're man-made vegetables, Dave. They're not even real. They're not in wild. You don't have broccoli growing out in the wild. It's fake, and they spray it. They're genetically modified. You're absolutely right. Marnie says, is there a reason to see a doc for a possible broken toe? I smashed my foot this week. Top of foot is bruised. I can walk flat-footed, but hurts. You know what? Wear your shoes. You said a toe. Tape the 2 toes together. Put something in between the 2 toes, like a pad. Roll up some toilet paper. Put it in between the 2 toes. Tape them to buddy tape. And yeah, it acts like a little cast. But don't go barefoot. Okay? Don't turn your foot. Just get a crutch or a cane for just a short period of time. But go to a doctor. What are they going to do? Yeah, it's broke. Do buddy taping. Well, what if it's not broke? Do buddy taping. If it is broke, do buddy taping. I don't think they're going to cast your toe. Even if you had a fracture on the top of one of your metatarsals, again, unless unless there is extreme swelling, and I think that it's not just a little fracture, it's like a big fracture, like it's displaced, there might be a time when I say, you know what, I might want to go to an x-ray and see if it's really displaced. Although I've had people who have really displaced it and they let that just calcify. No cast, no nothing, no surgery. Now, did they have arthritic joints in their foot from then on? Well, probably. It's everybody's decision, okay? You have to decide what is best for you. Judy says, I'm never going to the doctor again unless you cut off your finger or need a hip replacement or get in a car accident or do something. But for your chronic diseases that you don't have, no, you don't need a doctor. Oh, you're okay, Marnie. QQQ in front of the question. I got it. You guys on Instagram are so polite, so that's why I don't. It's mostly these YouTubers that are not very polite. Marnie says, I'm not sure I want to live past 65. Well, whenever God takes you, Marnie. I know that you're a believer and it's up to God. Romantic said, that's an awful shame on doctors. I agree. I was one of them. I still claim to be a doctor. Doctor today know nothing about real health. It's possible, Judy. I can't speculate. I can only hear from what you guys are telling me. Or, you know what my favorite is reading Medscape. Like when these doctors write on Medscape. So it's just a doctor place or Doximity, and doctors will author these articles. And then, I did it the other day. And so this person, this doctor had this thing about RFK. Whether I believe RFK or don't believe RFK, I'm not going to write about RFK. I have no interest. It is a waste of my energy. And this doctor was talking about some stuff about vaccines and blaming people and then just going on this rant. So I decide I'm going to go look this doctor up. And this doctor also believes that a woman's body is hers and she can do whatever she wants with it, including killing a baby in the womb. Now, I don't care where you guys stand on that. But now when I look and I associate her current article with her past articles, I know where she stands. She doesn't care about you or a baby or about God, because everything else that she had in her articles was definitely not of God. So I erased all of that from my head. I ejected it. I prayed about it, and I said, that was a waste of my energy. Why did I go down that rabbit hole? You already had a gut feeling, which is my heart, my Holy Spirit, telling me that is wrong, 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 wrong. Get it out of your head and move on. I don't even remember her name, nor do I want to. But that's why we have doctors. They got a religious and a political agenda to make themselves look right. And they're going to wear a stethoscope around their neck to get you to believe them. And they're going to dangle death in front of you. I want to do none of those things. I just want to provide information. You get statins and they get status. That's a good one. That could make a good t-shirt. That, you know what? It works. That one's, find the truth. That's another good one for the t-shirt. Speak it. What you're saying is true. Amen, says Romantic. I'm just going through these. Lucy says, bamboozled big time. I want to say, I escaped from the bamboozlement. Bamboozled by the buffoonery. No longer bamboozled by the buffoonery. Lucy says she's going with Jesus too. Awesome. I want a big family. Oh, Judy says her results came back. She's pre-diabetic. What a joke. My cholesterol was 112 and said that was high. I told the doctor I will never take your pharma drugs. I eat healthy. I wonder what the doctor said. Judy says the only thing that was not normal was her vitamin D level was too high. She's probably taking vitamin D. We don't need to take any supplements. They're fake. They're synthetic. Stop doing it. Hi, Karina. Hi from Brazil. 2 months onto the carnivore diet. Oh, seriously? That's awesome. That's awesome. Lucy, her family's from Brazil too. So you guys might have a lot to chat about, but thank you for joining. I appreciate it. That's awesome. Okay. All right, you guys, let's call it quits. I will be back. I'm here every Saturday and Sunday. I will try YouTube again tomorrow and see how that goes. I'm starting to gain more and more people over there who really want to ask, pertinent questions and not having an agenda to make me feel bad or do something like that to distract me. I'm getting better at not being distracted by you. I have helpers like Midwest Ribeye and Dave over there that are helping me out, and I appreciate that. I only want to help people. For whoever it is, I don't want any ill upon you, the people that are distracting my listeners. So, yeah, your Instagram, Lucy, exactly. Yep. Okay, Lucy's going to join over on YouTube. I appreciate that. Thank you. Okay, so every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. And then, I'm doing reels through the week on pertinent topics. Like them, share them. They have a new thing where you can repost them. If you like my stuff, if you think it's helping you, maybe it'll help somebody else. Okay? And I love helping people. I get frustrated, I'm not going to lie. There's a lot of frustration. Like I feel like I was getting frustrated with Oliver. And I don't mean to be derogatory. I just it's almost like I want to and say, wake up. You see, people have experiences, even me. I am hard nut to crack, okay? I want to be more like an eggshell than a walnut shell. I want to be able to accept constructive criticism more easily. In the past, I have not been so good about it. I'm getting better. And I think that is because my heart is changing. My heart is becoming more like Jesus. It will take me till the day I die to get past all of the hardening of my heart. Even you guys, I know you can relate. If you're a follower of Jesus, I know you can relate to this, but it is tough. And I have you guys to hold me accountable, and I appreciate that, okay? We all have struggles. We all have baggage. We all have our thing, and we need to help each other. So, okay, tomorrow, 10 a.m., Central, like, subscribe, share, clickety-clack, comment, do the thing, you guys, all right? So you guys have a good one. See ya.